Welcome to PRC Hard Talk. We're at the University of Sydney and we're discussing prevention policy actions and research with the experts, those involved in the very heart of the matter. I'm Bill Bellew. Today we're talking about alcohol and we're welcoming Michael Thorne, Chief Executive of the Foundation for Alcohol Research and Education.
Thank you, Bill. Thank you for having me here today.
You're very welcome to Hard Talk, Michael.
I hope it's not too painful, Bill.
Now, Michael, you've been the Chief Executive of FARE since 2011. Tell us a little bit about what you do.
Look, FARE's a fairly unique organisation. We're a well-funded charitable foundation. Our job at this stage is to deal with the problems of alcohol. Our mission is to stop the harm caused by alcohol, and we do that in a number of different ways. We were established in 2011, and the first decade of the operation was really focused at making grants for research, for treatment services, for a whole range of things in the area of alcohol and the harms that it causes in the community.
If I could just jump in there, Michael, you talked about harm, and we know from the experts that alcohol causes many things, chronic diseases such as cancer. It's linked, of course, with injuries and sadly with violence. If alcohol was discovered today, would we allow it into the community?
I think on the basis of the scientific evidence about the harms that alcohol causes, the magnitude of those harms, and it's not only to the drinker, of course, it's the second-hand drinking and the third-party harms that arise from that.
What is second-hand drinking?
So alcohol is a very significant contributor to family violence in our community. Third-party harms have been assessed to cost the Australian community about $20 billion a year. That's more than the costs to the drinker themselves from their drinking. So it's has a very significant impact on Australia and on Australians. And those third-party harms include the child protection issues. More than 10,000 kids are in the child protection system at any given time as a consequence of their carers drinking. We've got significant drag on productivity, so the impacts on industry from people's drinking. We have people who are killed by drunk drivers. There's a kind of a myriad of different examples of third-party harm. And I think that if we looked at the evidence, the fact that alcohol is a class 1 carcinogen, the fact that it has this spread of impacts on chronic diseases like cardiovascular disease, cancer, dementia, really we probably wouldn't be registering it. It'd be like tobacco, frankly, and
I'm almost reeling in shock. That sentence that you just uttered, alcohol is a class A carcinogen. I mean, that's shocking, isn't it?
Well, it is shocking, but of course, as we know, those of us working in public health, there are lots of substances that are cancer causing. It's all a question ultimately of the level of risk. But I don't think the community is really aware of the metrics around alcohol's risks, particularly when it comes to cancer, especially as we know from the cancer researchers who tell us that there's a dose response when it comes to the consumption. Every drink increases your risk of getting a cancer. Some those cancers are more significant than others. About 1 in 5 breast cancers, for instance, are attributable to the consumption of alcohol.
Presumably the reverse is true, so every reduction is doing us good.
Yes, and I think what the addiction doctors will say, for instance, that less drinking is better for all of us, and that includes the heavy and dependent drinkers, but also for those of us who are lighter drinkers.
Now, you started telling us about the work of FARE, but I know that you're no stranger to policies and policy makers. I mean, you spend time in the Department of Premier and Cabinet in more than one place, and you've been in this role since 2011. What has been achieved under your watch at FARE, and perhaps a little insights into how you've worked with the different ministers, the different advisors to achieve your success?
It's been kind of a fascinating journey for me, and I've worked in the health area for a lot of that time. I also spent a bit of time working on law and order policy, for instance, where population health approaches are very similar to the public health sector.
We'll get onto the lockout laws a bit later.
Yeah, but it's been there's been good and bad over this period. I think the most kind of difficult thing, really looking back, has been the application of neoliberal economic policy.
What does that mean?
Which has seen really a relaxation of the controls around the availability of alcohol in our community. This started back in the late 1980s in Victoria, and really has just accelerated to a point now where the alcohol's availability is ubiquitous. You can almost get it 24/7. You can get it in all sorts of forms, and of course with our kind of gig economy now, you can have it delivered to your home with 30 minutes notice at practically any time of the day, and that's not good for our community. At the same time, I think public policy making has got more and more difficult. The power of vested interests has been, in my view, on the rise. Their ability to
this is
influence
big industry,
be it big alcohol, big food, big coal. It has had a very kind of corrosive effect on our political systems, and really, in my view, has significantly undermined the virtues of our liberal democracy.
I remember being surprised to hear the alcohol industry actually invited around the policy-making table in some countries. How are we doing in Australia in that regard?
Not very well, it has to be said. The WHO, of course, says that the alcohol industry, and along with other harm-causing addictive industries like tobacco and big sugar, for instance, shouldn't be involved in the policy making, the policy formulation when it comes to controlling these harmful substances. But we've had examples here in Australia very recently.
You've been in premiers and cabinet. You must have seen occasions when the industry have come in for some meeting or another with ministers.
All the time, and they operate across a continuum of the sorts of ways that they go about it. And initially, it's all kind of soft influence. They invite people to sporting events. They issue free tickets. There's records, for instance, recently been released from the Australian Parliament of the numbers of cases of wine that have been made available to our politicians, right through to the threats and intimidation of members of Parliament, that if they pursue a particular policy line, that those vested interests will campaign against them. It's real, and it happens, and it does leave an indelible mark on the minds of all politicians.
And what about efforts like Drinkwise, for example, where they help us out with the education and the responsible drinking? How does that sit?
Well, Drinkwise is your classic social aspects and public relations organisations. It's funded by the alcohol industry. It is designed purposely to deflect government from real and evidence-based policy. And the alcohol industry have been very successful around the organisation establishing these organisations. And too many Australians and too many politicians, frankly, think that organisations like Drinkwise are part of the answer. They're not. They're part of the problem.
I think you're not taking us into a realm of banning alcohol completely from what you've said earlier, but isn't there some kind of gold standard, an ideal policy framework based on the evidence with actions that we know are going to work? What does that look like or feel like, and is there anywhere that's actually doing this, or any countries we can look at for good practices?
That's a big question. Well, let me kind of begin by saying alcohol has been part of human behaviour for arguably 20,000 years. I think some of the archaeological records will show that that's the case. Now, not all countries, of course, consume as much as Australians. Australians consume about 10 litres of pure alcohol per person, per adult, per year.
That seems more than enough.
That's more than enough. That puts us in the kind of top league of nations. But more than 60% of nations in the world are very low drinkers. They're down in the order of 1 and 2 litres, and there are all sorts of cultural and religious reasons for that. But Australians are up there with the best, and while our average per capita consumption has been on the decline over the last decade, the fact is that alcohol harms continue to rise. In about 6,000 deaths per annum, 140,000 hospitalisations, 1 million kids affected by their carer or friends of their carers drinking each year. So this is a significant problem. The gold standard that you talk about, I think there is a couple of ways to look at that. In Australia, of that all that alcohol that's consumed, 20% of adults don't drink anything, so about 20% of people are abstainers for one reason or another. Another 20% drink 75% of all the alcohol. Every single one of those are drinking way in excess of what the National Health and Medical Research Council recommends as what's good for us, and they say no more than 2 standard drinks on an occasion, to minimise long-term risks. That's the risks of a chronic disease or an illness, and no more than 4 standard drinks on an occasion to minimise the short-term risks. But across the Australian population, that includes all the non-drinkers, the average consumption is actually above that 2 standard drinks standard that the NHMRC recommends. So that's one way, I think, of looking at the problem. The other way of looking at it is that total consumption. We're not talking about prohibition in Australia. Alcohol, I can't foresee a situation where alcohol won't be part of this culture, certainly not within the foreseeable future. But we should be looking at trying to get less drinking. If we can get down to, say, what the Italians are consuming, around about 6 litres of pure alcohol per adult, I think that would be good for the health of Australians in so many different respects, and that's kind of a way that I approach this issue of what's the gold standard.
You haven't yet impressed me with great achievements from FARE. It does sound a bit like a losing battle, partly against social norms that think it's a great thing, for example, to have Brad Fittler, head coach of a New South Wales origin team, down beer to celebrate a win against the opponents on national television. I'm also mindful of the fact that domestic violence tends to spike around the times of these games when there's alcohol just about everywhere you can look, alcohol advertising, that is. But you're up against a big opponent, a well-resourced adversary, the alcohol industry. Aren't you on a loser?
We could be, but I don't think we are. There are people in the alcohol industry who really would like to see the back of me. I think that we have had a significant impact on Australians thinking about alcohol. The fact that average per capita consumption is on the decline.
What makes you most proud when you look back on the time you've been at FARE? What are the things that you would regard as real wins?
I think there are 2 kind of sets of wins. The first one is, I think FARE has played a very significant role in bringing order within the public health sector. We've spent a lot of time working up policy, funding research, so in order that we can develop the kind of policy responses and prove the sorts of things that we generally know, because there's a long history about alcohol control that goes to the price of alcohol, its availability and the way it's marketed. So we've kind of got the recipe. What we need to do is to establish those kind of the important things around each of those policies in Australia. So I think that FARE has had a very significant role, firstly in bringing some order, providing some of the infrastructure, and being a very strong voice for change around these sorts of alcohol policies. I can then point to sort of sets of policies. So FARE was instrumental, along with the Police Association and the AMA in Sydney, for instance, to bring in the last drinks laws, where we've had this extraordinary success in reducing the number of nighttime assaults and the presentations to St Vincent's Hospital's emergency departments, reductions in excess of 50%.
But you can't take those wins for granted, can't you? Isn't there opposition even as we speak?
Well, there is always opposition, and that vested interest is working every day to try and wind back these population-wide measures. In other areas, so, we've had restrictions on availability policies introduced statewide in Queensland. In the Northern Territory, we've got an extraordinary transformation of the policy environment underway there, where the Gunner government has actually totally embraced the problem of alcohol and its impact on Territorians, and not just the Indigenous population. They're all Territorians. Because in the Northern Territory, if we saw it as a country, it would be in the top 10 drinking nations in the world. And that regime, that government, has introduced Australia's first floor price on alcohol. It's re-established the banned drinker register, which targets the individual heaviest drinkers. They put police on the doors of bottle shops, for instance, to deal with problematic consumption of alcohol. So there are some places in Australia where lots of good work is done. The West Australian government, for instance, has a long history of investing in good, strong public awareness campaigns. They've been a leader for so many years. It's a pity many other jurisdictions don't follow their lead on that, because I think that this issue of people's awareness about the problems that alcohol causes, particularly the long-term health risks, is been poorly handled by governments. And as that evidence about the risks of the health risks associated with the consumption of alcohol over the long period, the cancers, the cardiovascular disease, the dementia, we need to be telling Australians the truth about this product, and that alcohol actually causes harm and can be a risk to your health.
I can remember a researcher presenting some information about evidence-based policies, more or less in priority order. And then in another column in the same presentation, she presented the policies that are actually most popular or usually enacted by Australian governments. It was an inverse of the evidence. What are the hardest things to get over the line, Michael?
Tax policy is undoubtedly the hardest thing to do. Restricting the availability of alcohol either through density controls or trading hours controls is not too easy either, it has to be said. And politicians kind of fall for this kind of sucker punch that comes from the alcohol industry about it's the problem of the individual drinker, and what we need to do is to target those abusers of alcohol and teach our kids to drink more responsibly. And so that's why you see these kind of vehicles like Drinkwise pop up, and they favour the public education campaigns about responsible drinking.
Everything in moderation.
It's all nonsense, of course, and research shows that these alcohol industry-driven narratives around moderate drinking and responsible drinking are no more than pro-alcohol messages.
This is starting to sound like the tactics we've had in other industries like tobacco, dare I say it, gambling, responsible.
Yes.
Whereas what you've been telling us really is it's the environment and everything around individuals and families that make those drinking choices too easy is the problem.
Absolutely the problem. It's kind of the metaphor about the fish swimming in the polluted river. It's got no chance of survival when the environment is so polluted in the way that it is when it comes to alcohol. Alcohol advertising is prolific, the marketing of the product is prolific, the price competition that you see is prolific. We're really up against it has to be said, and your question about are we fighting a losing battle is a very real one that preoccupies me and my colleagues all the time. But I think that you can overcome that, because fortunately the Australian population is deeply suspicious about these vested interests, and they tend not to believe what the alcohol industry says about the magnitude of harm and what their motivations might be in promoting their products.
Well, I don't know about the motivation of others, but I certainly know we have one very motivated chief executive of FARE in the studio today. Michael, you've given us a great account of what FARE is up to, the lie of the land and alcohol policy. We're so grateful to you, but I'd like to give you an opportunity for any last comment you might wish to make.
Bill, thank you for having me in today and being able to speak to you about my favourite topic. It is a hard battle, but it can be very rewarding. And I think that the decision recently of food ministers in Australia and New Zealand to mandate pregnancy warning labels on alcohol products is a perfect example of what we can do in public health if we work consistently and persistently to achieve what we know is right for public health and for all Australians, and in the case of pregnancy warning labels, women who are thinking about getting pregnant and women who are pregnant. It's been a major accomplishment. It's taken many years, but it shows you that you can achieve these things, and it's the right thing to be done.
Congratulations.
Thank you.
Michael Thorne, CEO of the Foundation for Alcohol Research and Education, thank you for being on PRC Hard Talk.
Thank you.